Hey, Jesse. Hello. All right, I'll go ahead and get started, and everybody can catch up. So, I'm Brooke, the nurse practitioner and co-owner of Port St. Lucie Medical Wellness. And every Monday at 7:30, I go live and we answer. Hey, oh man, I forgot to text you back, Jillian. I'll text you tonight. I'm sorry. Um, every Monday I go live. Sometimes I'll cover a topic that I think may be of interest to everybody else, like GLP-1s or peptides or IV therapy or lasers, that kind of stuff. Um, and then I give everybody an opportunity to ask any questions, and they can be related to anything, any health and wellness, med spa, aesthetic kind of questions. I'll be happy to attempt to answer for you. And if I don't have the answer, I will certainly find it for you. So, that being said, we are located in Port St. Lucie. We're at 702 Southwest Port St. Lucie Boulevard. So that's in between Gatlin and the Turnpike, off of Del Rio Road right there. And our phone number, if you'd like to call us, is 772-207-0080. So we'll get started. So just some updates today. I don't really have a topic to talk about. I kind of covered everything so far, but we'll do some updates. I'll go through all my specials with you guys, and then we'll ask some questions. So I have a raffle going on right now, and that's for Elastin. Elastin is a skincare product line that is manufactured through the makers of Galderma. Galderma are the same people who manufacture Dysport and the Restylane filler line. So they also manufacture this product called Elastin. They have several different items in that product line. One of my favorite is the tinted sunscreen moisturizer. That's actually all I wear. I wear that, and I do, some concealer underneath and then powder. So I get that. It's just got enough tint just to kind of blur the skin a little bit, and it doesn't leave me greasy or oily or anything like that. And I'm prone to breakouts, so it's hard to find something like that. But that's just one of their products. Of course, they have eye care products, vitamin C, and then facial washes and stuff like that. So, that being said, we are having an Elastin raffle, and those of you that have been in the spa have noticed a basket of Elastin products sitting up there on the front counter. Those products are, I think, 4 different items, and they are valued at over $500 of Elastin products. And to enter that raffle to win it, you can come by and just purchase an Elastin product. So you purchase one product, you get one raffle entry. And you purchase 2, you get 2 raffle entries, so on and so forth. So that raffle, I will be live Friday afternoon, and I will pick the winner for that one. So you guys have until Friday afternoon to come and get entered into that raffle. Moving on to kind of long-term, long-standing specials. Anybody who leaves a review, a Google review, gets a $25 credit towards their next purchase. And that could be towards anything. It could be towards a laser, filler, Botox, whatever. There's also another referral bonus. If you refer a friend, that's another $25 bonus. I have these little referral cards on the back. You can write your name. And then when your friend brings that in, I'll put a $25 credit on your account. Again, that can be used towards anything. New patient specials, we have the first 60 units of Dysport at $4 a unit. After that, it's $5 a unit. And then we have the new patient special for Botox. That's 20 units for $179. So a little bit of savings. Currently, we are doing a pretty good special for microneedling with radio frequency. It's a relatively new machine that we've got that I've been wanting to get for a long time, and we finally got it. So usually that treatment runs about $600-700 a treatment. You can do it for the whole face, you could do it for your neck, you could do it for the backs of your hands. Some women will do it for their stomachs to treat like skin laxity. So it'll treat skin laxity, scarring, acne scarring, fine lines and wrinkles, um, and help you promote collagen, and so you get that nice bounciness back in your skin. So we do a series of 3 treatments, 1 treatment a month, 3 times, and then you kind of just wait and let your body do its thing, making its own collagen and everything. And then after about 6 months or so, we reevaluate and see if we need to do another treatment or if you're good. If you're good, then we just do maintenance treatments after that every year. So we have a model call right now for the microneedling. So if you want to do that, you can absolutely call me or text me and I can put you in for that. The only thing, so you get 50% off a package of 3. The only thing that I ask of you is that you let us take pictures and post before and afters. So usually a package of 3 is $2,100. And the package of 3 for the model call is $891. So it's a pretty good, significant savings. With that, you can add on PRF or PRP. So some people will want to add on PRP because that is also collagen promoting and elastin promoting. And I'll draw your blood, I'll spin it down to get the red blood cells out of it, and then I'll put it in syringes. I can re-inject some of it like under the eyes or right here, or if you've got a lot of skin laxity, throughout the neck, I can re-inject it there, and then whatever you've got left, we'll utilize for skin repair on the skin after the microneedling session. I'll give you whatever we've got left over in a little syringe, and you can continue to apply that to the skin 2 or 3 times a day for the next 48 hours. It's good for 2 days. And then after that, we'll give you a different elastin product that will also help cell turnover and help you produce more collagen. So you can add on the PRP for $100 a treatment. The next thing that we have is Sculptra. Sculptra is another biostimulating agent. It is under the classification of fillers, but it's not really a filler. It is a polyl lactic acid, so it's a PLLA. What it does is it promotes your body's own ability to produce collagen. So typically we say for every year over 30, or every 10 years over 30, we do 1 vial. So if you're 30, usually we'll just start with 1 vial. A month later, we'll do another vial. A month later, we do another vial. And typically where it's done is where we start getting this hollowness in the temples. We'll do it along the cheeks. I'll kind of feather it through here. We'll do some like in the jawline, a little bit here because we lose a lot of volume here, and then we'll do a little bit here. So after that treatment, you have homework after that one. You've got to massage the skin or the areas treated for 5 times a day for 5 minutes for 5 days. And that's just to prevent nodules. So sometimes the Sculptra can go somewhere and get kind of stuck, and then you have an overproduction of collagen there and you can get a little nodule. So that massaging is to prevent those nodules from occurring. So we have a package of 3 right now. Is regularly $2,100 and it's $14.97. So again, that's pretty significant savings. We also have a bio-repeel. So that's a pretty good peel for people who live in Florida or states where you typically get a lot of sun. Because it is not photosensitive. So sometimes some peels will require you to stay out of the sun for 2 weeks before and 2 weeks after. The bio-repeel does not. Hey, Kara. The bio-repeel does not require that of anybody. So it's Florida safe. And it's also safe for all skin types. So there's Fitzpatrick skin types 1 through 5, 1 being the lightest shade and 5 being the darkest. So it's safe for all skin types. It's not going to cause any scarring or hyperpigmentation or hypopigmentation like some of the other ones do. So we do that in a series of 3 typically. So again, 1 treatment once a month for 3 months. And then after that, you just kind of do maintenance. But it's good for hyperpigmentation, acne scarring, fine lines and wrinkles. So a package of 3 is normally $600, and we've got it for $447 right now. We also use the bio repeal for acne. For example, Michelle has been treating my daughter, and whoops, and she's had 2 treatments so far, and I would say she's probably got 50% reduction in her acne. So she's got pretty severe acne. She's got PCOS, so that causes even more acne. So we're doing that for her once a week for 4 weeks, and then after that, we're gonna do it once a month just to kind of keep things under control for her. But even after the first one that Michelle did, I noticed a difference the next day when Haley woke up. There was a noticeable difference in the amount of acne she had. So I'm super pleased with that, and hopefully, she's 13 and she don't want to walk around like that. Kids are mean. So hopefully that helps her a little bit, but we'll do the treatments. The last one we have is Resurfix. That's another laser. So that one is an ablative laser, meaning it does cause like ablation of the skin, like burning of the skin, the first layer of skin there. So you are pretty red afterwards, probably for 2 days, maybe a little red, a little swollen. That one is good. It does exactly what the name is, resurface. So it resurfaces the top layer of skin. So again, good for hyperpigmentation, fine lines and wrinkles, acne scars, skin tightening. It is going to help you produce collagen and elastin. That one is regularly $1,500 for 3 treatments. Again, we do 1 treatment a month for 3 months, but we have the 3 right now for $997. So that's all the specials we have. We always have the membership option as well. So the membership is $129 a month. You get a couple different services for free. You can pick. So, and I'll tailor it. There's nothing like cast in stone with the membership. So I say you can pick between a IPL photofacial, an IV service, or some laser hair removal. But if you are typically coming in for other things like the pelvic floor chair that helps with bladder incontinence and stuff like that, then I will give you that every month for free, right? So it just kind of depends on why you're coming to us, what results you're looking for, and the treatment that you are going to be doing on a monthly basis. So we will accommodate for that kind of thing. So it's not just like set in stone, you have to get these things for free. You get a free B12 vitamin injection every month. The filler, so any Restylane or Juvederm fillers are going to be $150 off. Those can range anywhere from $599 up to $799 for each syringe. Then the Botox, Xeomin, and Dysport are all going to be at a discounted rate. So Botox is usually $11, and members will get it for $9. Dysport is usually $10, and members will get it for $8. Or excuse me, Xeomin is usually $10, and members will get it for $8. Dysport is usually $5, and members will get it for $3 a unit. So pretty significant savings. That's $129 a month. If there's no obligation, right? You have to stay 1 month to use it, right? So we don't want people just signing up and then getting their IPL and then never coming back again. So you can cancel at any time after that. So that $129 a month, you can pause it. So for people who are here, just snowbirds, 6 months on, 6 months off, you can pause it and then restart it when you get back. Or you can leave it going, and that $129 a month will just go towards credit in your account for anything you want to use it for. So if you don't use that monthly membership to get something for free, you won't lose that money. It'll stay in your account and it will accumulate, and you can apply it towards any other treatment you want to get. I think that's all I have. That was a lot. Does anybody have any questions that I can answer for you? So again, that Elastin raffle will be closed Friday afternoon. So if you want to get in on that, which I recommend, just stop on in, buy an Elastin product. We have, there's ones that start at $18 and there's ones that go up all the way to like $200. So you don't have to spend a lot of money to get entered into that raffle, and it's about $500 worth of stuff in that basket. So again, we're located at 702 Southwest Port St. Lucie Boulevard. You can call us at 772-207-0080. You can DM me on Instagram, Facebook, either mine, which is Be Injected, or the Port St. Lucie Medical Wellness ones. You can text me on either of those. And you can also text the regular phone number. I'll get the text message through that. What'd you miss, Kara? Kara said I missed that, so I don't know what she's talking about. Anybody else have anything you'd like me to add? Going once. Hey, Danny. Oh, the raffle. We'll stop by this week, Kara, and grab something, and then we'll put you in there. I know, somebody should have told you about it last time you were there, because it's been there all month. All right. Any questions, comments, concerns? No? All right, let me write everybody down here. Yeah. Amara, Jillian, Mario, Mari, Jenny, Lily, Kara, Danny. Hey, Danny, can I talk about your heels? The PRP? Lash Wiz. If Danny doesn't mind, I'll talk to you guys about a treatment I did for him. Okay, he says yeah. So Danny is a gentleman I met through the Port St. Lucie Business Club. If you guys got a business in Port St. Lucie or the surrounding areas, this is a great business club to kind of connect with, network with. They're getting bigger and bigger and bigger. They have they have monthly meetings, and usually these meetings are, something fun like bowling, a catered event where you can go eat, drink, have fun, and you just meet local business people. So it's always good to support, privately owned local businesses. Anytime I do anything, it's through that. I'll ask Danny if he's got anybody for something, and, just to give back support to the community we're serving. So that's Port St. Lucie Business Club. They're amazing. I met tons and tons of people with them, and a lot of them were very helpful in the process of getting this place going. So anyways, while I met Danny, he had mentioned that his heels were hurting him. So this is a sign of what's called plantar fasciitis. So the bottom of your foot, right? If this is your foot, this is your heel. There's a tendon that runs along where the toes are through the bottom of the foot and attaches to the underside of your heel. So usually when you have an arch in your foot like this, and when you're running or walking, that puts tension on that arch and stretches it like this, and that's where that tendon is. So a lot of people who get plantar fasciitis are people who have a very high arch, and the shoes that they have been wearing are not supporting that arch, and so that tendon has been stretching. And what happens is, you go running, you're trying to work out, and you have that constant tugging pressure on that tendon. It pulls on where it attaches to the heel, and it causes a miserable pain. I have it. It's absolutely miserable, particularly at night, so you never get to sleep. When you get up in the morning, it feels like you're walking on needles because that tendon is super tight and you got to stretch it back out again. It's miserable because it's just like never ending. So what I did for Danny is I drew his blood. I got his PRP. I put it in a syringe with a little bit of lidocaine, and that lidocaine is just to kind of give you a break in the pain. It doesn't take away the pain. The PRP is what helps with the inflammation, so to kind of decrease the pain. But a lot of times when we're in this pain, like this super high pain state for a long time, the body is now in like this chronic pain cycle, and something's got to break it, right? So I put that lidocaine in there to kind of break that cycle and stop your brain from thinking this hurts, this hurts, this hurts, this hurts. And so I think it's a combination of those two, that break in the cycle, and then the PRP helping with the inflammation. And everybody that I've done the PRP for the plantar fasciitis has been better after the first treatment. I had one girl I treated and she started crying. I worked with her through the whole day, and I just noticed she was limping, and I brought her back, did the PRP injection, and by the end of the day she was in tears because she had been in so much pain for so long, and then it was gone and it never came back. Oh yeah, I did Danny's left knee as well. So I did PRP for his left knee as well. I forgot. Okay. So again, the same theory. You put it in the joint. You can do it for tendon pain like the plantar fasciitis. It would help. Kara's asking, would it help with gout? It would help with if you're having an acute flare-up, that inflammatory phase. It would help bring down that inflammation. But it wouldn't help. What happens with gout is you have acid that's built up in your system, so those acid will accumulate in a joint. Typically it's in the ankles or the toes, a distal joint from your body, and those crystals will accumulate in the joint, and it's miserable. So it causes impingement on the joint. You can't move. It's super painful. And there's medications you can take for an acute flare-up, and then there's other medications you take to try and prevent a flare-up. So it will help with the inflammation and the acute pain, but it won't help with the crystals. That you will need a medication for. So it would give you some relief from the inflammation. And then Hollywood, can you have PRP if you had a knee replacement? Absolutely. Absolutely. So same thing. If you've had a knee replacement, you shouldn't be in pain. So that's another question I would have. So maybe you need another MRI to kind of follow up on that. There's a lot of recalls on hips, knees, those kinds of things, those implants that might be applicable to you. And that would warrant, to me, another MRI if you're still having pain in that area, because most people who have a knee replacement are like skipping around the place. They're totally fine. So, but yes, it would help. It would help with that inflammation. So he says, I have 2 knee replacements and my right knee is excruciating pain and I can't bend it at all. Did you have them done at the same time? Or were they were they separate from each other? So he's saying his right knee is still very painful, which it shouldn't be at all. They were at separate times. Was the right knee done before or after the left? Was the right knee the one done in 7 years ago? So you had one done 7 years ago, one done 6 months ago. We'll wait for a response. So I'd be curious, Hollywood. I would go see whoever did your surgery or maybe another orthopedic surgeon. Oh, the left one was 7 years ago. Right one, June 2024. I would, if it wasn't, even if it wasn't here, I would go to another orthopedic. I mean, I could certainly do the PRP injection and that will give you some relief, but I'd be interested in getting another MRI to see what's going on with that, or even just an X-ray. When I went to my doctor, they told me my knees were fine, and I'm not fine at all. Yeah. That happens with a lot of people that go to the doctor. They tell them they're fine and they're not fine, and then they come see me. So I'm probably gonna ask my primary care. Yeah, you could do that too. Yeah, ask the primary care. I'll be happy to look at it too. Before I started doing aesthetics, or while I was doing aesthetics, I was full time at orthopedic and spine place where we often did PRP injections, but typically the PRP was done for like, minor meniscus tears, minor ACL tears, because it does promote healing of that tendon or ligament. If something is completely torn, no, you need surgery. But if there is minor tearing of the ligament or the joint capsule and stuff, it will repair it. Oh, good. Okay. So they're coming on the 27th. Perfect. All right. We'll talk more about it then. All right. Anything else? That was a nice little tangent. So let's do this. Liam, are you in a position to come pick somebody? So usually on my lives, I'll give something away. I haven't decided what that is yet, but I'm gonna have Liam always picks for us. So let's see. You can pick any of these people. Do this one. I don't know who that is, but yeah, you could pick. Let's see, we got Amara, Jillian, Mari, Jenny, Lily, Jagar, I don't know, Kara, Danny, Lydia, Jen, Lash Wiz, and Hollywood. And Jesse. My cousin Jesse is on, so that was good to see him. But he's in Arizona, so I'm not giving him anything for free. Wouldn't work out. Lash Wiz. That's it? All right. Lash Wiz. You are the lucky winner. What are we going to do? Let's do 40 units of Dysport. So for Lash Wiz, what are you doing with my pen? We'll do 40 units of Dysport for free. So Lash Wiz, DM me and I'll get your information, unless you've been to see me before and I've already got it. But either way, DM me so then I can secure all the details with you. Anybody else? Anybody else? Let's see. Make sure there's no questions here. All right, guys. So I will let you guys go back to your Monday evenings. And we got homework to do, so I'm probably you probably do as well. So have a good Monday night, and I will see you guys next Monday. Bye.